Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Peripheral neuropathy, that is something that we are very concerned with. If you have it, you are concerned. If you don't have it, you have no idea what we're talking about. So Dr. Usry, who is a real expert in this, is here. And Dr. Kevin Usry, why did you take this on as something so important?
Well, we're a family practice clinic, and around the early 90s, we started seeing a lot of patients coming in with this problem. It really had a lot to do with how people started eating. They went on that low-fat craze that lasted many years and created a lot of diabetics and a lot of people who have insulin issues. And as a result of those abnormal chemicals floating through the body, a lot of people started developing peripheral neuropathy. So we started a program 20 years ago. I started with a laser. This was before the FDA had cleared lasers, so we had to have people sign waivers. We used vibration therapy with the laser, and we were getting some good results. Over a 20-year period, we've brought a lot of different technology to our program, and we have an 87% effective program now that doesn't use medicine, it doesn't use injections, and it doesn't require surgery. In a matter of weeks, we can get patients back to doing the things that they had to give up because they couldn't feel their feet.
I was just going to ask you, describe what a patient feels when they have peripheral neuropathy, please.
Well, for most people, it starts out as some numbness and tingling that may be intermittent and then become a little bit more regular. The numbness and tingling can move into pins and needles and even burning sensations. This is generally when the patient will see their internist or their family practitioner or see a neurologist or a podiatrist. All of these doctors work with tools out of pretty much the same box. They have pharmaceuticals to offer the patient, and that's it. These pharmaceuticals do nothing to correct the problem with peripheral neuropathy. And while we're talking about the problem, it is a problem with the very small arterioles in the feet and the hands. And these blood vessels become constricted where they're no longer able to dilate and bring the rich blood to those particular tissues. So patients start getting these numbness and tingling symptoms, these pins and needles, these burning sensations. As the condition progresses and more nerves die off, the patient no longer is able to feel their feet. Worse, the brain no longer is getting that vital information called proprioception, and the person's balance becomes a problem. This is why every 11 seconds, a senior citizen is seen in an emergency room as a result of a fall. So now these are the ones that have to go to the emergency room. Many, many more falls occur every 11 seconds.
And we know what that means. And so how long, if someone comes to see you, how long from the beginning that you start will they be seeing any results?
Well, the studies have shown just using the light therapies alone in 12 visits, those patients noticed a 50% reduction in their symptoms. We use many more modalities, so usually around 8 visits, we start seeing significant changes.
You should know that you are now on Facebook Live.
Ah, well, hello, Facebook Live.
We just had someone say they're watching. But let's just go, really into this problem. So if someone does not come to see you and they try to live with it, what's that like?
Well, they'll go to their medical doctor and he'll give them things like gabapentin, Neurontin, Abilify. These are medications that change the neurotransmitters in our brain. Yes, they're not narcotics. They just slightly change how we perceive pain. Isn't that interesting? They originally used this medication for additional treatment for depression.
Really?
Oh, yes. All our feelings come from the mesolimbic system. Those are where our neurotransmitters are housed. So if you're having pain, they tweak those neurotransmitters a little bit, and the patients stop feeling the pain. About 30% of them. Now, I'm not quite sure the percentage, but a number of the patients who take these, because they alter their neurotransmitters, they feel very unusual, they don't like the side effects, and they stop taking it. To be fair, some people who could probably use a little bit of medication, who are taking it for their feet, also find that a lot of their issues emotionally seem to straighten out as well. So, but again, the big thing is this does nothing to address the issue of the peripheral neuropathy other than the pain. It doesn't take care of the problem.
Dr. Usry, but Usry, sorry. No, I want to get this right. I thought that a lot of people who've had cancer treatments wind up with peripheral neuropathy.
Yes. Let's start, since you asked that question, let's start with what categories we see of people coming in with peripheral neuropathy. About 40% are the insulinemic and hyperglycemic patients, as well as the diabetic patients. So all problems with metabolism of sugar and insulin and its repercussions, about 40% of those patients that are with peripheral neuropathy are coming through the door. 30% have a genetic predisposition, meaning they have what we call a SNP, a single nucleotide polymorphism. And what this is it's a little genetic defect, so they don't absorb any of their B vitamin. B vitamin is one of the most necessary vitamins for the biochemical processes that go on in our body every day, especially the epithelial tissue, which are our blood vessels.
And so they're not getting that, that's not
they're
coming
not
through, it's
absorbing
blocking it.
Yes. And that's only the canary in the cave as far as the peripheral neuropathy is concerned, because when you're not absorbing your B vitamins, homocystinemia occurs. This is a condition that leads to many neurological conditions, cardiovascular conditions, strokes. Back to the original question you asked about people who've received chemotherapy. Yeah, you don't take any B vitamins or folic acid when you're on chemotherapy for a specific reason. The chemotherapy is targeted towards rapidly advancing cells. So they don't want to stimulate even normal cells to rapidly divide. So because of the way they're trying to save this person's life, yeah, some of their folic acid pathways in the patients get embarrassed, get dysfunctional. So we address that in the office. That, along with other medications, such as statins, believe it or not, can lead to these peripheral neuropathies, and that's about 20% of the cases that come through the door. The last is really not even peripheral neuropathy. It's called tarsal tunnel syndrome. It mimics peripheral neuropathy. So patients come through the door, they think they have peripheral neuropathy, and some actually have that and tarsal tunnel. But a number of the patients we've seen just have this mechanical problem, and we fix the mechanical problem, and the symptoms go away.
You are so smart about this. How did you, that's silly to ask, but how did you find out about this?
My uncle had it. And he came down for a visit, and basically it fostered in me a desire to find out what's going on, because even way back then, they didn't even have the medications to deal with the pain. So he was just always uncomfortable, and he ended up having a lot of falls. He broke his hip. He ended up ultimately dying in the hospital. You know, when you break a hip, you can throw a fatty embolism, and he had a stroke and died. So I tried to carry on some work that I thought was important. And, no one's addressing this. This is a big problem. To give patients only medicine that covers up their symptoms, to me, it reminds me of an old saying, I got the bum's rush. Doc threw a prescription at me and said, oh, yeah, go do that. Well, some don't even do that. Some physicians don't even do that. They don't know what to tell. I just had one come in. He says, I don't know what to tell you.
Huh. It's interesting, with all the articles that we've had, peripheral neuropathy was always one of the things in something. But you really have been writing it specifically for it. And I'm very pleased to know that. You You really are an expert in this. And so people who are listening, of course, I want them all to know what they can do. Why don't you try this? Let's get you to call them. Very important to call Dr. Usry. I'll get that. Usry. I got it now. Usry. Okay, Dr. Kevin Usry. And he's up there in Lake Park. And his phone number is 561-863-8779. I'll repeat that now because, remember, this is Pencil Talk Radio. It is 561-863-8779. And his website is allamericanwellness.com. Now, I know you do other things, too, even though we started out talking about this. If someone would like to come to see you, what do you feel that your next best thing is for them?
A lot of people think we only address peripheral neuropathy, and that's not true. Chiropractic is the only profession that addresses keeping you well, meaning our paradigm in this country is, well, I go to the doctor when I'm sick. I don't go to the doctor to stay well. Though if people think about it, they go to the dentist, and usually the preference is to go to the dentist just to get your teeth cleaned. If he finds a cavity, oh, great, but you don't want to go with a cavity. It's terribly painful. So there we do kind of use that paradigm of being proactive about taking care of a part of our body so that we don't have problems down the road. And now we've learned with dentistry, well, that oral health is so important to keeping our heart health and all of our overall well-being. Chiropractic has dealt with the nervous system since 1892. Any of you out there who don't understand that it's your brain that runs your entire body, well, maybe you need to do some research on the internet. The fact of the matter is, if we keep our nervous system healthy, all the other systems in our body will work well. Our cardiovascular system, our respiratory system, digestive system, most importantly, our immune system. And I'm saying that now because the flu has just devastated this country this year. And the vaccines were 36% effective. We've had thousands and thousands die in this country this year because their immune systems weren't fortified. This is what chiropractic is all about. As a matter of fact, there was a study done years and years ago in the Carolinas where they looked at patients who had seen chiropractors prior to the polio outbreak didn't suffer with polio.
Really?
Yes, because chiropractic is all about keeping our immune system strong. Not everybody got polio. Polio's a virus. Some people had strong enough immunity to it, they didn't develop it. And that is all about what chiropractic does. We're all about making sure the body works at 100%, because that's what your nervous system is designed to do. Help every one of your systems work at 100%. But if the nervous system isn't working well, then all of the other systems don't work well. You're the head of this company. You don't show up for work. Yeah, the employees know kind of what they're supposed to do, but they need the leader. The leader makes them work efficiently. That's exactly what the nervous system is in our human body. It's the leader. So why does chiropractic address that? That's the most important system in the body. If we can keep you healthy by keeping your system healthy, you don't take drugs, you don't have to have surgery, your quality of life is improved. So we have a 32-step protocol that addresses neurology, biochemistry, and biomechanics to keep the patient as healthy as possible or to return them to as normal health as possible. We don't compete with the medical doctors. Their job is to treat disease and pathology. They do it better than any other doctors in the world. But there are so many people that have functional problems. It's the majority of the symptoms we deal with on a daily basis. That is what chiropractic is about. We treat function. Someone comes in with peripheral neuropathy, their blood vessels are not functioning normally. Their nerves now are not functioning normally. We return the function. That's what chiropractic's all about.
We have people who are really enjoying you on the Facebook.
Oh, wonderful.
And you look
Hello,
so good.
people out there.
You look so good. They want me to bring you on camera, but I don't do that because this is a radio show and you're doing this.
Of course.
But Dr. Usry, this Dr. Kevin Usry, right? Did I do it good that time?
You did.
Okay. So people, though, ought to really just go meet you and have you work on a program that will keep them well. That's what I'm getting from this.
Yeah. If you go to your dentist and your teeth have not been taken care of for years, they're going to see you pretty frequently for a while, and then they're going to put you on a maintenance program to keep your teeth healthy. Well, if you understand that concept, why not kind of stretch yourself and apply it to the rest of your body? If you do something to keep your health, and you're doing something as proactively as you can, then you're going to stay healthy. And listen, I'm 62. Getting old is no piece of cake. It's not for sissies. I think that was Betty Davis who said that. It's not for sissies. And you have to be proactive.
Well, I don't think I've ever met a chiropractor like you, and I've met a lot of them. But you do have a different outlook on it. It's not someone coming in, okay, my back hurts, and thank you very much. You say, let's see what's going on, and let's keep you from having that backache. Is that what I'm saying?
Yes, that's what I say. But, Anita, believe me, all chiropractors believe that. Some share it with their patients. Some don't. We're all human beings, right? So some are naturally chatty, like myself.
I love it. That's right.
Others may not be, but that is not my message. That's chiropractic's message. Chiropractic has been keeping people healthy since 1892. Thank you very much.
Thank you very much. And something that I know that you take care of children also. It's not just for adults, is it?
Everybody has a nervous system. Everybody. And if you've ever seen how a child is delivered, as the child comes out of the vaginal cavity, the head is twisted to twist the entire body. Of course, this has been done for years and years and years. Instead of putting drops in the child's eyes, worrying about gonococcal and all sorts of different infective issues from the vaginal canal, how about adjusting the child? How about getting that nervous system normalized from the trauma of the birth? Gee, that makes a lot of sense.
Yes,
we adjust children who are days old. As soon as they're out of the hospital, their mothers bring them over, and we adjust them. When it's appropriate.
That's really important to talk about that. But I want to now talk about the elder people who are lying in bed. They don't move much. Some of them are very sick. Would you go? How do they get adjusted? Sorry, did I ask something that's tough?
It is tough because
though that happens, right?
These are people that are suffering with a lot of diseases, a lot of pathologies. I won't say it hasn't happened in our practice where we go do home visits. It's not the common paradigm. Typically, we see people who are having functional issues, but they still continue to function, and so they're able to be ambulatory and move. Though I have to tell you, a number of patients who come in who are new patients, unfortunately, they come through the door in a lot of pain, barely able to move. So our job is to help them do a lot better going out than coming in.
I know people who have pain and they take, I'm taking a leave and I feel better.
Well, that's good. No, that's a great insight. Anybody who takes a leave or Tylenol or aspirin and they find relief, that's a wonderful thing because it tells us they'll respond to essential fatty acid therapy. Yes, God made our prostaglandin pathways, which are anti-inflammatory and inflammatory. If we balance those essential fatty acids, we can get the patient to understand, you're having pain? Pop a sesame seed oil. Pop a fish oil. Take some flaxseed oil. It's incredibly amazing what these oils will do to reduce inflammation. So that's why I say, if they respond to Tylenol, if they respond to Advil, if they respond to aspirin, that means they have an inflammatory condition. Well, there's natural ways to beat those pharmaceutical approaches hands down.
Well, you talk about the flaxseed oil. If I eat flax seeds, is it not the same? What's the difference in having the oils?
Well, the oils, of course, are a more concentrated aspect of the flaxseed. You're not getting the husks. You're not getting a lot of the fiber. You're just getting the oils, the chemicals. And I'm not telling you to take flaxseed oil. In our office, we test in our office. We do applied kinesiology. And
I love that. Tell people what that is. I know you have a short
applied
time.
Kinesiology is a specialty. In the United States, it's pretty much relegated to chiropractors. This is an international organization. In Europe and Asia, it's mostly medical doctors and dentists. We work with utilizing muscle testing to evaluate neurology. We provide sensory input to the body of a different nature. Could be biochemical, it could be mechanical, it could be energetic, and we look for the brain's response. It gives us a great amount of insight to functional issues that the patient has, including biochemical imbalances.
I just love it. We're going to have you come back again. You
I'd
are
love to.
so interesting, and I'm going to look up some of the things you said because I love it. So, Dr. Usry, it's just wonderful to have you. I'm going to give your phone number again, and just call, make an appointment, 561-863-8779. 863-8779, and the website is allamericanwellness.com. 561-863-8779. That's Dr. Kevin Usry. Thank you so much for being here.
It's a pleasure, Anita. Thank you for having me.